Wallahi, if you did not check the knowledge of the patient, they will check it for you in the feedback.
Audio. Audio Jungle. Audio Jungle. Audio Jungle.
Let me clarify more.
بسم الله الرحمن الرحيم والصلاة والسلام على أشرف خلق الله أجمعين سيدنا وحبيبنا محمد صلى الله عليه وسلم. Today inshallah I'm going to talk about communications. Brief introductions about communications. Then if the time allows, I will take one scenario in communications. Scenarios of communications. If you go to any communication stations, whether this communications is whatever the scenario, there is fixed beginning frame and fixed ending frame. In between these two frames, there is the scenario. The scenarios that might get it inside the exam might be breaking bad news, disease counselings, an example, medical error scenarios, side effects scenarios, uncertainties scenario, procedures scenarios, drug scenarios, HIV as examples scenarios, and organ donation scenarios, or post-mortem examination scenarios, or even occupational disease scenarios. You and your luck. You will never get other scenario other than what I mentioned to you scenarios. What's your fixed beginning? The fixed beginning, any patients with communication, any scenario, communications, the fixed beginning, then fixed ending, then in between these two, there is the scenario. Then I will take the fixed beginning. The fixed beginning is triple C's. The first C, the second C, the third C. The first C, confirm the patients, confirm yourself to the patients. Then confirm the patient identity. Then confirm the agenda of meeting. Then after this, do ask him, do you want anyone to attend this meeting today if you are dealing with breaking bad news or disease? Then after that, ask him double H, how do you feel now? Then, and how much do you know about your health status? Example, hello, good morning, my name is, confirm myself, my name is Dr. Adam, one of the doctors in the clinic today, nice to meet you. Nice to meet you, doctor. I would like to confirm that, are you Mr. John? Yes, doctor. Confirm the patients. Then confirm the agenda. Mr. John, we are here today to discuss some issues related to your health status. Is that okay with you? Yes, doctor. Then shift yourself. Mr. John, can I ask you please, do you want anyone to attend this meeting with us today? No, doctor. Or then, Mr. John, how do you feel now? I am okay, doctor. Then, Mr. John, how much do you know about your health status? Here the patient, he will tell you his story of his story with his disease. Yes, doctor, I am suffering from 1, 2, 3, 4, 5. I am suffering from coughing, above blood, shortness of breathing, loss of weight. And after this story, he will give you the last investigation he did, like blood test or imagings, whatever, CT scan or MRI or whatever the test. That is why This is fixed beginning for any patients with communication. Keep it like this as a frame to start with. Because in communications or in these exams, if you start right, the examiners will continue with you right. And if you start wrong, they might continue with you wrong. Hello, good morning. My name is Dr. Adam, one of the doctors in the clinic today. Nice to meet you. Nice to meet you, doctor. Confirm myself. Confirm him. I would like to confirm that. Are you Mr. John? Yes, doctor. Mr. John, we are here today to discuss some issues related to your health status. Is that okay with you? Or to your health conditions? Is that okay with you? Yes, doctor. Before I proceed further in my discussion with you, do you want anyone to attend this meeting today with us? No, doctor. Mr. John, how do you feel now? I am okay, doctor. How much do you know about your health status? And if you did not check the understanding of the patient for his disease, they will check it for you in the feedback, and they will write that the candidate, he did not check the understanding of the patient to his disease. You have to know at which level the patient he know his disease. That is why. Yes, doctor, how much do you know about your health status? Yes, doctor, I am suffering from 1, 2, 3, 4, 5, joint pain, skin rash. I'm suffering from abdominal pain. I'm suffering from coughing up blood. I did the test 2 days ago. They did for me a test, and imaging or blood test or CT scan, and now I came to know what is the result, doctor. Ask him immediately as soon as he gave you his story and he put his test. Ask him, what's your expectation for the result of this test? No, doctor, I have no expectations. To understand what is his level of awareness for his disease. Again, to sum up for you, tomorrow, if you go to any exam of communications, put this frame. Hello, good morning. My name is Dr. Adam, one of the doctors in the clinic or in the ward today. Yes, doctor. I would like to confirm to you that, are you Mr. John? Yes, doctor. Mr. John, we are here today to discuss some issues related to your health status. Is that okay with you? Yes, doctor. Mr. John, do you want anyone to attend this meeting? In case that, you will ask this question in case that. This question is for disease or cancer. If you would like to explain disease or to explain cancer, it's better to ask this. Mr. John, do you want anyone to attend this meeting with us today? No. Then shift yourself. How do you feel now, Mr. John? I'm feeling okay, doctor. I am suffering too much. How much do you know about your health status? Yes, doctor, I am suffering from 1, 2, 3, 4, 5, 6, 7, 8. I did imagings yesterday. They did for me blood test, and I don't know what is wrong with me. What is your expectation for this test, doctor? For this imaging, do you have any expectation? No, doctor. This is fixed beginning. Then here I will stop. From here I will go to see what is the scenario. Whether I am dealing with number 1, breaking bad news, cancers, and the cancers divided into 3 parts. Cancer with DNR order, cancer without DNR, cancer, treatable cancer, or disease scenarios, and there is around 30 diseases. You have to know about it, starting from multiple sclerosis, epilepsy, celiac disease, but disease of the ossific, around 30 diseases you have to know about it. And the medical error scenarios, side effects scenarios, uncertainty, procedures, drugs, HIV, or even organ donation or postmortem examinations. Each one of these scenarios, there is a frame. Yani for breaking bad news, there is frame. For medical error scenario, there is frame. For disease, there is frame. For uncertainty, there is frame. For post-organ donation, there is frame. HIV, there is frame. Don't waste your time. Keep only the frame and apply this frame. I will read my scenario like this. Yes, there is cancer. Yes, there is disease. Yes, there is medical error. Yes, there is drug. There is immediately I will bring the frame and I will write the frame if you apply the frame, you will practice this scenario easy. But if I have no frame in my hand, if I have no weapon, if my hand to fight this both examiners and this surrogate, I cannot pass. If you have no frame in your hands for each scenario, you will be in trouble. After I finish in my frame, I will come to the fixed ending. And the fixed ending is C triple S's. The first C is concern. The second S is social. The third S, the first concern, the first S, social, the second S is social, summary, then support. I will come to the fixed ending where, when I finished my task, immediately I will come to the fixed ending. As soon as I finish my task from here, go to end your scenario by asking the patient, what is your concern? Then ask from the social, excuse me, can I ask you some question related to our discussion today? It might help me in my discussion with you, because they will write for you, don't take history in the paper. Then I will ask from his, what is your job? Then how this disease affecting you in your job and daily activities? Then can I ask you please regarding the smoking and alcohol if need? I will ask from them, and the driving if need. What is the benefits of social in communications? The benefits of social in communications is to pick out the welfare of the patient. Example, the patient with epilepsy. I will ask him, can I ask you please some questions related to our discussion with you? It's your job. My job is teacher. How is this disease affecting you in your job and daily activities? Do you smoke? Yes. Do you drink alcohol? Yes. Do you drive? Yes. Do you have any favorite activities? Yes, I have swimming. Immediately go to the welfare by I need. Don't say to the patient you have. Say, I need from you to stop smoking, I need from you to stop alcohol, because this smoking alcohol can react with the medication that we are going to give, and I need from you to stop the driving and to inform the DVLA regarding that. And I need from you also to avoid any swimmings in case that you have any fits while you are swimming. It will be dangerous for you. This is the benefits of the social. In case that there is some questions related to his disease, you have to ask. As example, as I said to you, if she is female with epilepsy, as example, what's your job? My job is a teacher. Do you smoke? Do you drink alcohol? How this is affecting you in job daily activities? Can I ask you private questions? Are you married? Yes. I need from you to stop smoking alcohol. I need from you, your pregnancy should be planned pregnancy, because this lady now diagnosed with epilepsy, and they ask you to sit with her, to tell her about the epilepsy, and if you did not give her advice that her pregnancy should be planned between the woman doctor and the brain doctor, she will get pregnant, and at the same time she is taking sodium valproate or something for this fits, and the baby will get neural tube defects. Here she can complain against you. I need from you to stop the driving and to inform the DVLA. If you did not stop her from the driving, the insurance company will come and they will search in the documents in the system, and they will get that the lady, she was documented or diagnosed with epilepsy. The doctors, they didn't give her advice to stop the driving. The insurance company, they will say, we will not pay. Who will pay? You will pay. Because you inform her she has epilepsy and you did not stop her from the driving. That is why this is the benefits of the social. Then summary. I would like to summarize to you, you have been troubled with symptoms, test, diagnosis, plan of management, and advice. The summary, symptoms. I would like to summarize to you that you have been suffering from the fits, recurrent attack of fits. Diagnosis, we did test, we did for your imaging and this brain tracing, don't say EEG. The result has been, the diagnosis was epilepsy, and the plan of management to be treated with multidisciplinary team involving the brain doctor in our patient clinic. And I advise you clearly to stop the driving and to stop swimming. Can I ask you how much did you get from our discussion today? This is the summary and recap. Summary and recap. Then support. I will give you a leaflets, brochures, websites to read more about the epilepsy. And I will give you the contact number of the hospital in case that if you have any questions, don't hesitate to call us to sum up for you. This communications around 11 scenario, the exam will never go out of this scenario. As I mentioned, breaking bad news, disease, medical error, side effects, uncertainty, procedure, drugs, HIV scenarios, organ donation, postmortem examinations, or occupational disease scenarios, whatever. Don't worry. For each scenario, there is frame. Simple frame. يعني breaking bad news as example for cancer. What is the difference between the lung cancer and the liver cancer and the kidney cancer? Different cancers, but the frame is one. Use only one frame. This frame will cover for you. You can practice with this frame all these cancers. But before I go further to this cancer, there is fixed beginning. When you finish this fixed beginning, go directly to your frame that cover for you all types of cancer, all types of disease, as example, all types of medical error. Yani as example, the patient given penicillin by mistakes. This is medical error. And the patient given, as example, thiophylines, at the same time they gave him clarithromycin lead to thiophylline toxicities, and he developed this. This is medical error. And also the patient having benzodiazepine medical error. Different medical error scenarios. The patient given overdose, he developed of insulin, he developed hypoglycemia, written like medical error. Different medical errors, but the frame is one. You will start your fixed beginning, then go to your disease or to your scenario by its frame, breaking bad news frame, disease frame, side effects frame, medical error frame, HIV frame. Go to this frame. Finishing your task, close your scenario, concern, social, summary, support. Bye-bye. Because if you have no frame in your hand, you will forget concern, you will forget social, you will forget to do summary and recap, and you will forget to do support. That is why the time is not allowed to choose scenario, but I will, inshallah, the coming week, I will do my best to choose one scenario like breaking bad news or medical error, side effects or procedure or anything. I will come now to sum up for you. Fixed beginning. Hello, good morning. My name is Dr. Adam, one of the doctor in the ward today or in the clinic today. Nice to meet you. Nice to meet you, doctor. I would like to confirm that you are Mr. John. This is the second confirmation. Yes, doctor. Mr. Sir, confirmation agenda. Mr. John, I would like to confirm. Mr. John, I would like. We are here today to discuss some issues related to your health status. This is the third confirm agenda of meeting. Then, Mr. John, do you want anyone to attend this meeting with us today? No, doctor. How do you feel now? I am okay, doctor. How much do you know about your health status? I am suffering from 1, 2, 3, 4, 5, 6. Joint pain, skin rash, abdominal pain, headache. I did imaging, I did test yesterday. And what is wrong with me? What is your expectation for this test? This is close till here. This is the fixed beginning. then go to your frame. Whatever breaking bad news or anything, then come as soon as you finish your frame from here, your task from here, immediately go and close your scenario. What is your concern, Mr. John? What's your concern? Do you have any concern? Then social, then summary and recap, then support. And the concern is divided into two parts in the communications. Concern from the patient sides and the concern from your side. And the time is not allowed to go for skills of communication, which is CCCW. Both examiner observing you for CCCW. CCC is W. The first C is communication skills, the second C is concern, the third C is clinical judgment, and the W for welfare. Based on this CCC's W, they will assessment whether you are going to pass, to fail this exam. That is why I'm talking briefly about the concerns. The concerns of most of the candidates, they fail the communications because of the concerns. As example, the concern from the patient side, doctor, is it infectious? Doctor, is it contagious? Doctor, is it treatable? Doctor, am I going to die? Doctor, is it familiar? That means, what about my kids, doctor? Doctors, I want to take my father to Canada, as example. Doctor, is it treatable, doctor? By this doctor, he will disturb you. And you will lose your frame, and you will forget your skills. You forget to ask the concern. You forget to do to ask social, summary, support. And sometimes, if the concern from the patient side, if the patient he said to you, doctor, I have changed in the colors of the nail of my little toe. This is negligible concern. Doctor, I have a change, or I have a pain in one piece of my hair, Because this is negligible concern, you will say, okay, you will be busy with another things. And the examiner, he will ask you, by the end of the exam, did you solve the patient concern? When he asked you, doctor, I have a change in the color of one piece of my hair, or change in the color of the nail of the little toe. They will take this concern, plus concern in station 5, plus concern in the history by this exam. You will get yourself fail this exam because of skill, despite that you pass with a score. This score around 156, 160, 156, 150, 140, but you will fail with skill. The name of this skill is concern. That is why in talkative stations, communications, history stations, station 5, or long clinical consultation in the new system, the people inside the exam failed because of concern. But in clinical station, the people fail because of finding. That is why take care to not be one of the victims of concern or findings. And if you would like to pass an exam, don't take this exam as one unit. You will fail and it will be difficult for you. Cut the patient into pieces. This pieces is skills. You have to know what they want from you, these examiners. What they want from me. They want from me skills. And if you know what they want, you will do what they want, and you will not do what you want. What you want, as example, in the presentation of cardio or abdomen or the chest, all of us, we have problem in our presentations. We will start by negative findings. On examination of this gentleman, he is lying comfortable. There is no peripheral stigmata of chronic liver disease. There is no jaundice. He is lying comfortable. There is no bladder, no jaundice. No. This examiner, he will start. Stop. Give us the positive finding only. We came from our country to examine you just because of positive findings. Don't waste our time. We have no time to mention the negative finding. At that time, you will get mental block, and you will don't know what to say. That is why link your heart to the finding, you will pass. Link your heart to the skill, you will pass. Inshallah, the coming week, Bismillah Azza wa Jal, Inshallah Azza wa Jal, we will choose either breaking bad news, disease, medical error, whatever. And we will all, as example, if we choose the medical error or breaking bad news, all the scenarios that expected to appear in the exams, and with only one frame we can cover all of them. جزاكم الله خير. إن شاء الله نشوفكم في see you إن شاء الله in another sessions. Goodbye.